Well, to get more analysis on the dire humanitarian situation in Gaza, Dr. Yipeng Ge joins me now from Ottawa in Canada. Doctor, it's good to have you on the program. You yourself have spent time in Gaza. You know how desperate the situation there is. The suspension of aid to northern Gaza, what will that impact be like, especially for medical facilities there and for those working there, who are, of course, not just doctors, nurses, health staff, but they too are going through this war themselves?
I mean, to hear that news come that the Israelis will not let aid go to the north any longer is just incredibly devastating, knowing that there has already been such scarce resources been allocated to the north. When I returned from Rafah to Canada, I started to learn of the multiple children now in the double digits that have died from starvation and dehydration in the north. And I am afraid that with such news, with such limitation of food and other aid going to the north, we're just going to see hundreds, if not thousands, of children and people die in the north.
Doctor, you mentioned that you spent time in Rafah and you've just returned from there. Tell us what you saw, particularly at medical facilities, because I think that for so many of us, it's difficult to imagine how people there are actually coping, and especially those who are in need of medical attention right now.
I cannot fully explain how people are coping. I think that the moral distress that healthcare providers in Gaza have because of the limitations of food, water, and shelter. Everyone has been impacted by the limitations on those conditions that are necessary for life, let alone medications or healthcare professionals to take care of people when they're sick. And so with these overlapping crises that are structurally and systemically withheld by Israel, we're just going to see so many deaths. We're just going to see so many people die because of this ongoing genocide that continues to be upheld by Western powers, nations like Canada, like the United States, and like the UK. The things that I saw in these clinics were run-of-the-mill infections, respiratory diseases, gastrointestinal infections, hepatitis A, wound infections. I even saw rickets disease, children that couldn't walk anymore, that used to be able to walk, children that should be walking by their developmental milestones because they were 12 months old, 14 months old, but were not walking because of how severely dehydrated and malnourished that they were. And this was in the south. This is where there is a little bit more food and aid entering because they have some agricultural system still existing because there's just a little bit of food and food aid.
Doctor, if you are able to hear me, you were talking about developmental milestones, and the conditions that people are experiencing right now in Gaza are going to have long-term health and psychological consequences. Talk us through what some of those consequences are going to look like, especially for the very young children in Gaza.
I talked about the impacts of long-term severe malnutrition with another journalist, with another investigator in the past. And I thought about these children that I met at the clinic that followed me around because I looked different and I, kind of was interesting to them to follow me around. And they looked to me by their height to be 4, 5, 6 years old. And then I had to be told by other staff members that actually know these children that they're actually 10, 11, 12 years old. And so these were children that have been stunted, physically stunted as a consequence of the Gaza diet, the limitation on the caloric intake of children through the aid that was already being restricted into the Gaza Strip long before October 7th. And so when we start talking about the long-term impacts of forced starvation, now we're seeing children actually die. And if we think about even beyond that, we have the physical stunting, but also the psychological impacts. Children will not be able to reach their developmental milestones, let alone their cognitive potentials. And there are actually studies that show that people that are severely malnourished as children will go on to develop learning disabilities and even things like dementia, unable to fulfill kind of their potential as human beings. And this is systemic because this is a structural way in which life is being withheld from Palestinians en masse in Gaza, not giving them the chance to live here and now, and not giving them the chance to live a decent, full life, even beyond when a ceasefire comes, even beyond when humanitarian and aid can enter unrestricted. Because of what's already happened over these past 5 months, we're going to see the long-term consequences for all these children, all these people for the decades to come, if they are able to see another day.
It's incredibly sad to think that this is going to be passed down from generation to generation. Dr. Yipeng Ge, live to us there from Ottawa in Canada. Appreciate your time and talking to us. Thank you very much.